Imagine this, that you go to your physician, nurse practitioner, or mid-level provider. They take a history, they do a physical exam, they draw some blood, and they contact you in a week, and all the lab results are normal, and they say to you, you're in good health. And actually what's happening today in healthcare is they tend not to call you unless something is gone awry, if you will. So what I want to introduce in this particular module is something that's called the illness-wellness continuum. So the illness-wellness continuum. So let's begin over here, and we're going to move all the way over here. So here we have illness at one end. Here we have wellness at this end. And in the middle here, we have good health in the middle. So I want to go through each one of these because it's critical when you're thinking about the design and delivery of healthcare systems, design and delivery healthcare organizations, as well as from a health information technology point of view, is you know the differences between illness, good health, and wellness. So let's begin with illness. So with illness, you must have a diagnosis. And I talked about the ICD-10, which is the International Classification of Disease. So you must have a diagnosis. And then with that diagnosis, then you know that there's certain signs, and SXS are symptoms of what? Disease. So when you think about the term disease, you can be at ease, but when you have disease, then you're no longer at ease, if you will. So those are the characteristics of illness. So now let's go to the opposite side and look at the characteristics of wellness. So with wellness, there is no diagnosis. So let me recreate that. So we have, erase this one more time. So with wellness, you have no diagnosis, but what you have is optimal well-being, and the emphasis on optimal well-being. Or what you have is peak performance when you're focusing on wellness. Or what you experience is vitality and vigor. So those are some of the elements when you take a look at wellness. Now in the middle, between illness and wellness, you have good health. So we have wellness over here, peak performance, optimal well-being, health promotion. We have illness over here, disease, infirmity, ICD-10. So what exactly is good health? Good health is no signs and symptoms of what? Disease. So just because I'm in good health doesn't mean that I don't necessarily have a disease. It might be the fact that they can't detect the disease through certain diagnostic procedures. So that's actually what the reality might be. So let me erase this for a moment here. So get it all erased. And we'll continue this discussion about illness, good health, as well as wellness. So if you think about the design of our current healthcare delivery system, it largely operates within this particular frame right here. So our current healthcare delivery system tends to be disease focused. Financially, why is that the case? Because once you have a diagnosis using the ICD-10, then you can bill for it using the CPT codes, and that generates revenue. So revenue for individual providers as well as provider organizations. And there is a societal need to have a disease-focused healthcare delivery system. What's beginning to happen with the Affordable Care Act, so with the ACA, The ACA then kind of evolved this to focus on prevention. So if you're a Medicare recipient, then you have your annual wellness visit. And then if you want to get a colonoscopy, a mammography, a cholesterol screen. So there are a number of preventive services that you can get from the healthcare delivery system for most health plans at no cost to you. So that is an emerging model within healthcare today. What's also beginning to emerge one step further is really focusing on promotion. So promotion is employer wellness programs, worksite wellness programs, community wellness programs. So people being involved in even things such as yoga and meditation. So that really is focusing on optimal well-being. So we're beginning to see, when you think about the design of healthcare delivery systems, is that these healthcare delivery systems are beginning to go all the way across the illness-wellness continuum. And that's good news for everybody. So I thought it was very important to kind of highlight this illness-wellness continuum, because you fundamentally have to make choices about where you want to add value and make contributions as a healthcare professional, whether it's a clinical role, an IT role, a predictive analytics role, or an administrative role, or an entrepreneurial role. So always go back to the illness-wellness continuum and where do you want to add value. Thank you very much.